So, another live session with me, James, the Neethus Academy, reading live. Hope you all are waiting for me, as I am always waiting for each one of you, because it's an honor to come and say so much, come in front of you every single day. Right, as students are piling up, what has Neethus Academy in stores for you? We give training for n number of exams, training. Okay. So if you are unaware of what are the things that you have the benefit of, or what can you do in order if you do this exam, is it more easier? If you have any doubts with regards, please do not hesitate to contact the number which is on the screen. They'll be happy to assist you. Monica Vegas, good afternoon. Very, very, very good afternoon to all my lovely students. Atira Sally, good afternoon. Excellent. So were you all eagerly waiting for me? Yes? No? Yes? I'm sure you all are. How was your studies? Or how are your preparation going on? Are you all getting benefit out of what you're attending with me? Yes, Kalai, good afternoon, Maldives. Happy to see a lot of, profound names. Monica, yes, fair enough. Right. Good enough to see lot of names popping up. Neethu George, good afternoon. So as just as students are piling up, 𝐿𝐴𝐺, good afternoon. A new name, 𝐿𝐴𝐺. If anybody new, please do let me know if you're new and where you're from. Okay, I love to say that I have known people across the globe. Monica benefited, okay, fair enough. Ashwati Mohan, good afternoon. And also I love to see all those icons next to your name, because that shows the support that you are rendering towards us. Because if you have at least one icon, that shows that you are there supporting us for all the things that we are doing. That means you're happy with whatever that we are doing. That is why we keep on growing on a daily basis. If you really look into the very same page, the likes are more, the followers are more. If you know that we have few Telegram channels and WhatsApp channels, Telegram pages, there also every day we have a number of students who are piling up. Vinitha, good afternoon. Sunita Manu, good afternoon. Right, so no matter wherever you are from, whichever part of the world you're from, a very good morning, good afternoon, and a good evening for all my lovely students. Okay, say again, there's no, what can you say, thing on the aspect, because our job is to make sure that we become that bridge between you and your dream. Because yesterday also we had a lovely session with all our exam proud students who have made us proud of their achievement. So they were all saying, Simia Jai, hi, Revati, good afternoon. Jenny Justin, good afternoon. Tina Anthony, good afternoon. Susmita Thomas, good afternoon. So they were all saying about, how things have been to them. What are the things that they were going through. And I can literally feel how they would feel when they get that thing. Right, we have just pinned the WhatsApp channel, we have pinned the Telegram pages, all are free access for you. Please, if you have not yet joined, please do join. Okay, that's where you get the first-hand information. Right, I have Benita Raji from Kuwait. I had few people from Kuwait, a lot of people. So I love to say, welcome to Neethus Academy Reading. Rasna Suraj, good afternoon. Kavita Balaji, good afternoon. Uttam Kumar, good afternoon. Why it is an pride for us is when a student comes and says, I'm made to that dream. When a student has that kind of a willpower to make sure that I will achieve my dream, and when they say my dream has come true, it's the most fruitful thing for any trainer. Okay, so we are so blessed to have a lot of students every time when the result keeps on popping. There are a number of students who make it to their dream. Sophia Jiten, good afternoon. Juby Jens, good afternoon. Sharon, good afternoon. Betsy, good afternoon. Sweetie Jinto, good afternoon. Eben Worky, good afternoon. Ramya Bijan Varghese, good afternoon. Srimol Mohan, hi. So that's our job, isn't it? No matter whatever it is. I know that I push my students to the extreme. I know that. But still, that's all for that particular day that you say, whatever that you have gone through, you have that beautiful life coming in your Rashmi Ji Raj, good afternoon. Soni Raju, good afternoon. Soumya Joseph, good afternoon. Anita Simon, good afternoon. Renita Joan, good afternoon. Sandhya Vishnu, good afternoon. So yes, so much of known names, and if you have not yet liked our page, please do like our page. If you have not yet subscribed to the channel, please do subscribe, not for any reason. Okay, that is just to show the love and affection that you have towards us. And the only way that I would gauge, okay, if you feel that my classes are beneficial, please do not hesitate to share on your social media platform. Now, why I ask you to share? One, the number of shares will decide whether all of you are feeling whether my classes are beneficial for you. Okay, that's how I gauge about myself. Anu Ann, good afternoon. Chinju M. John, good afternoon. And the more number of shares, that means more number of people are finding my classes beneficial. And also another thing is, when another student share, see, you wouldn't share anything that you don't feel that it is not valuable, isn't it? When you share, another student sees it. There are n number of students across the globe who are still unaware that we give these free classes. Okay, so in order to go and reach them, our hands, we have a limit to spread, but when you spread along with us, it reaches globally. Now, why? What is the benefit with that? See, one, another student also makes it to their dream. That's all. Fancy good afternoon. Now, what are we going to do? We will be doing two things. We'll be talking about a part B. We'll be doing a part A, which I've already shared on the very same page. But you get the first-hand information in our exclusive reading Telegram page. In order to get into the exclusive reading Telegram page, we have kept a scrutinizing policy. Now, why scrutinizing? Please be aware you're on an online platform where n number of fraudulent people right now we have in front. Okay, we can't just stop them. But the only way that you can be is just to be cautious about. When they message you, just block them. We will not message you. We will not ask you to do any other thing. If we want, we'll come straight to you. Because that's why we always keep on reminding our students, if you have anything, you may call that number. We will not contact you for anything. So if somebody contacts you, please be aware it is not by us. That's as simple as that. Alfina, good afternoon. Ashwita, Bangalore, good afternoon. Soumya, Saju, good afternoon. So that's how confident we are. Because as you can see, our next regular batch, it's from Feb, March, April. Till that time, we are completely full. Okay, that means that's how much of a trust that student has. And we would never do any injustice to ruin that trust. We will push you to extreme, means we will push you to extreme. There's no doubt. Okay, and student says, okay, and there are, and I love that on the aspect. See, you are there like this, you are here like this. See, what is our job? Our job is to make sure that you all reach your dream. And in order to reach your dream, we have a clear-cut agenda. We have a stipulated syllabus that we take. Okay, so there is no dilution that we do depending on any student saying anything. No, we won't. I won't. Because I know what is beneficial for each one of you. And in order to do that, of course, it's not applicable, isn't it? We can't say that whatever that we are doing is going to be digested by every one of you. Not necessary. Okay. But if you do what we are telling you to do, we will ensure that you reach your dream with your hard work. No shortcuts about it. No shortcuts. So if you want to reach that epitome, you have to ensure that you're ready to come out of your comfort zone. That's the only thing. And we will make you come out of your comfort zone when you are with us. Mary Kuti Joseph, good afternoon. So as students have piled up, are you all ready for today's session? If so, give me a quick thumbs up and say, I am ready. And how many of you say that I will get all the right answers? I love that word, I will. Okay. Now, all of you are ready? Yes. Lot of new names that nobody have told me except for God, Neethu, is it? From Kuwait. Ibn work, you ready? All right, good enough. Monica Vegas, I am ready. Good enough. Inantoni ready. Excellent. Monica, I will. Very good, Monica. I love those students who say I will, because that gives a lot of positivity into you. Soumya, I am ready. Kale, ready. Kale, I will get. Very good. Keep it up. Keep it up. Excellent. Sharon, ready. Sophia, Juden, ready. Good enough. Good enough. Chinjur, ready. All right. Sweetie, ready. Okay. Good enough. Mary Kuti, yes, sir. Okay, fair enough. Soumya Saju, ready. Reshmi Jiraj, ready. Nancy, ready. Kavita Balaji, ready. As students have said, Diana Joseph, ready. As students have said that you're ready, the question will be popping up on the screen, and do not waste your valuable time. Do it as quickly as possible, and once you complete it, just put a sign saying done or put a thumbs up. Yeah. Ashwita, ready. Sandhya, ready. Soni Raju, ready. Good enough. I always ask you to comment. It's because the way you comment, that's the only way that I can gauge whether you are on the very same page with me. Okay, there you have the question. Please do the material and then we'll discuss. Right, time I've just alluded, is it? I could see a lot of new names, but Monica Vegas was the first one to say from quite a long time that done. How about others? Did you all find an answer on or before time? Did you? Yes, I'm sure you did. They've been work you done. Okay, good enough. How about others? Did you all find an answer? Kalei done. Okay. Ashwita done. Okay. Kavita done. Sophia done. Mary Kuti done. Sweetie done. Soni Raju done. Sharon done. Betsy done. Tansy done. Susmita done. Revati done. All right. Soumya Saju done. 𝐻𝐿, done. Right, as I wouldn't say all of you, most of you have said done. Now, see why it is important, okay? See, you have to always remember the class that you're attending, even though you're attending from your very own same place, you're attending an international class. Why international? I would say we have people from different parts of the globe. See, for example, we have people from all parts of India, people from Nepal, Sri Lanka, Maldives, Mauritius, Malta, Pakistan, Afghanistan, all parts of Middle East. Then we have people from different parts of Africa. We have people from Israel. We have people from Italy. What do you call it? Ireland, Scotland. We have people from Australia. We have people from New Zealand. We have people from UK, Canada, Philippines, Thailand, Singapore, Malaysia. That's how diverse the classroom is. And why you've been asked to comment. See, it gives you a lot of confidence in yourself. Why? See, I'm attending an international class and I'm saying, okay, this is my answer, this is what I got, this is where I got. That should always have and when you comment, you are taking your first step towards your dream. That's how you should be looking into it. Forget who was watching, forget what others will think, doesn't matter. Now, why I'm telling you this is, now I'm going to ask you what is your answer and where you got that answer from. I want all of you to comment. I got the answer this from here. Doesn't matter, right? All right? Tina Antony, done. Fair enough. So would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important because I'm a person who always believe it's not just telling one answer. My job as a trainer is to make sure that to correct from where you went wrong. Monica, A from the first 5 lines, absolutely good enough. Let's see if it is there. Kalea got A from overall just. Okay, fair enough. How about others? What are your answers and where you got that answer? Ashwita, A from middle portion. Okay, fair enough. So generally the first few answers are A. Penny Sebastian, A. Soni Raju, A from first few lines. Pinantoni, A from the topic sentence, okay. Fancy, A from middle. Uttam Kumar, A from middle part, okay. Mary Gutti Joseph, A from middle. Rebati Balakrishnan, A from middle. Tripti, middle portion, okay, fair enough, A, isn't it? Saumya Saju, A from middle, okay. Chinju M. John, A. So every one of you is saying A. Sandhya Vishnu, A. Alright. Soumya Joseph, A. Middle, okay. Betsy, A. Overall. So basically, you have only one answer as of now. So Smita Thomas, A from first and the middle part, okay. Sweetie, A from middle. Savita Balaji, A. Now let's see. What are your answers? Or if your answers are wrong, if your answers are right, it doesn't matter because there are in the very same life where all the students have got all right answers, 50-50, 25-75, 100-0 is also there. Okay. Now what are we going to do? We're going to talk about, the question will be popping up on the screen. Before that, just to make sure that what is the strategy? See, first and the foremost important thing, you should know your right way. That's called the strategy. What is your strategy? Strategy for part B is read the question. As you're reading, underline the keywords on the question, understand the question. 3 things which I would always remind my students, I will always push my students to do. Okay, because it is mandatory. Reading, understanding, and underlining. Now, what are you to do? How are you going to do? See, the keyword should not be more than 2 to 3 words. Okay, don't underline all those things. Keywords are words that will, when you look at that, you understand the whole concept of question. And the strategy for doing part B is called elimination method. Okay. Now, how are you going to do? What are you going to do? Now, as I've mentioned, you're going to underline the keywords in the question. So, the extract on randomized controlled trials on HIV infers. So, trial infers. Though that is enough for me. Okay, HIV and all is understood. So, this is a trial. What does it infer? Clear? Now, there are two ways to do. Then you can read your answer option and then underline the keywords in the answer option, then read the paragraph and pick it up. Or what you can do, you can read the paragraph, then underline, you can see from the answer options. So either way it is fine. Okay. So what, okay. I have few, Jenny's just saying C, 𝐻𝐶 is saying C. Okay, fair enough. I always love those students who have that courage to come. See, I got, this is my answer. It doesn't matter who gets what, I got this. Now you said C. Would you be kind enough to tell me how you got C or where you got C? That's important for me. Okay. So as I mentioned, now I'm just going to show you how. Okay, now see, when you're doing part B, you have to read these kind of, this is not a question mark kind of, you have to read along with your question. So the extract on randomized control trials on HIV infers presence of foreskin is a major precipitating factor. Presence precipitating. HIV infers circumcision performed by certain devices safe. So safe is a keyword. HIV infers immune systems are weak in males who are uncircumcised. Okay. Now, so generally the overall context is about, definitely it's about HIV, circumcised, device, all those things are there. Now, after this, you're going to go to the paragraph. So do not skip anything. Male circumcision and HIV infection. Now reading. A randomized control trial is the gold standard for scientific studies, and 3 such trials conclusively determine that male circumcision reduces female to male HIV transmission by about 60%. Okay. Then, responding to this evidence, so because it is about this, it can get transferred. In March 2007, the World Health Organization and United Nations of AIDS, UNAIDS, issued recommendations on male circumcision and HIV prevention. So they are giving, okay, we have concluded from 3 trials. This is due to 60% has been transferred. Now, what are the recommendations done by WHO and UNAIDS? Now, the primary target cells through which the HIV enters the body are immune system target cells with CD4 receptors, including Langerhans cells. So they are saying, okay, these are the reasons why it is going to get into it. These cells are present in high density in the epithelium of inner foreskin and are close to the surface. So this is about where these cells are present, which can be the triggering factor for HIV transfusion. Okay, the highly vascularized foreskin mucosa and the mucosa at the frenulum are prone to tearing and bleeding during intercourse. So these are prone for getting certain ruptures. And because of that ruptures, what happened? Because of HIV transfers using the blood, isn't it? So that is understood. So these micro injuries allows easy entry for the HIV into the bloodstream. So important note about device-based surgical methods. So there's a small spelling error. So for me, the highly vascularized foreskin mucosa, frenulum, intercourse, micro injury allow HIV. So what is it said about the HIV in first? They are saying presence of foreskin is a major precipitating factor. Okay, because the foreskin is there, isn't it? So now that is a factor too. So as what you have said, A is pointing into, let's see. In 2013, so before that, important note about device-based surgical methods. In 2013, the WHO stated that the male circumcision devices It pre-qualifies as efficacious, safe, acceptable as additional methods of male circumcision for HIV prevention among healthy men. Okay, so yes, you can use these devices for circumcision. Providers who perform circumcision using device-based surgical methods should appropriately be trained and competent in these specific devices. Now let's see if there is anything to eliminate. Now see, circumcision performed by certain devices are safe. Anywhere saying that certain devices are safe? This is a straight eliminator because they are saying devices are safe, not certain devices. Eliminated. Now, which we had, two students have said. So now, immune systems are weak in males who are uncircumcised. There's nowhere it is mentioned anything that these people are weak who are uncircumcised. Now, the only thing that they have said is providers who perform uncircumcision using this should probably be trained on. Understood? So, immune system are weak is nowhere mentioned in the paragraph. So, congratulations for all those students who have got today the right answer. The answer is A. Understood? Now, what made those differences? Circumcision performed by certain devices. See, now, the certain devices is the problem. Safe is the next problem. Not mentioned. In part B, you're not supposed to comprehend the answer. You're supposed to search an answer which is mentioned in the paragraph. Clear? Immune system, yeah, they're talking about immune system and all. But are weak in males who are uncircumcised is nowhere. So as I could see, Anila George, good afternoon. Soni Raju dancing, Kalai dancing, Uttam Kumar dancing, Soumya Joseph dancing, Kavita dancing, Balaji happy, Betsy happy, good enough, Tina Anthony happy. Why not, isn't it? We are here with a purpose. What is our purpose? To get all those things right, know the strategy, find out, okay, this is what my answer is, and am I right or not? Yes, I am. So congratulations for all the people who have got it right. Congratulations for people who have got it wrong this time. Why wrong this time? Because you've been corrected. Ashwita happy, Thansi happy, good enough. Rasna Suraj happy. Why not, isn't it? See, you have to make the most out of it. We are here to enjoy. Now, when you study, you should enjoy your achievements. After pushing through with all the difficulties, and when you get that score in your hand, that's the time that you relish yourself. Rasna, Monica, Akila, all are happy. Tripti, first time I'm getting. Tripti, absolutely good enough. Best, you have to always remember there's always a first time. And that's the beginning of your. Understood? Tripti, you don't need to thank me. You have to thank yourself, pat your back and say, I am able to get that and I will clear this. Okay? That's the only thing that we need from you. Right. So as all of you have said, you have got the right answers and you're enjoying it. Now let's go into the next one. What is the next one? Next one is part A. So what is today's part A and how you felt about today's part A? That's the biggest thing that I would definitely want, because after doing or reading your comments only, Neethu madam will be making the next day's material. So please be kind enough to give us your valuable insights about how you felt about today's material. How did you feel? Tell me. What is today's material? I know it's transanal endoscopic microsurgery. How you felt about today's material? TEM, easy. Okay, the first review I got is from Kalai, easy. Monica Vegas completed within 12 minutes. Easy material. Fair enough. See, now people who are already on the verge of knowing everything and who have been practicing, now it's high time that you compete with the time. Tina Anthony, nice, okay. Quite easy, Janus, all right. Akila Sham, easy. So generally it is more of an easy material, is it? Good enough to know that you're all finding it easy. But be rest assured, the material is not, it is always tricky. But it is because of your hard work that you're finding it easy. So pat your back. Kavita Balaji, easy. Tripti, easy one is tough one always. Let's see. See, Tripti, what one thing for you to always look into is, doesn't matter whether it is tough or not. What you feel, believe that. All right. Subiraj, good evening. So as you have all said that it is easy and all, now let's go and see what has it in store for us. All right. So we'll all go and see what the material has in store. I'm going to fire the 20 answers. It's high time that you take your pencil and start ticking. Tick, 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 tick. Count your scores. There you have the material. So what are the things that you have to be very cautious about? First and the foremost thing is about the strategy of part A. Strategy of part A is called skimming and scanning. Skimming means quick look, scanning means detailed look. How much time do we have? 15 minutes. How many questions do we have? 20 questions. How many parts do we have? 4 parts. Text A, text B, text C, text D, which will be based on one common theme, which is transanal endoscopic microsurgery. The new vocabulary making us to learn effectively, locate answers quicker. Fair enough. That's the only thing that we have. How can I get the materials before the class? Anila, as I've mentioned, there are exclusive reading Telegram page. Please do like the very same page that you're watching. We have shared all those materials there. Okay. Now, how much time do we have? So in order to do skimming, they say 1 to 2 minutes, but I say take 15 seconds per text. That's enough. So skimming means you're not going to read through all the word by word. Quick read it. As you read it, you underline the keywords. And I've told you a number of times what are the keywords, but if you've still not looked into there is a video that we have done exclusively for improving your part A scores. There I have detailed what are the keywords. Please do watch that. That will give you a lot of insight. Now let's see how skimming is done. Okay, so transanal endoscopic microsurgery TM is a procedure to treat the rectal tumors and other problems without making any knee incision. TM allows the surgeon to reach rectal tumor high in your rectum. In past, surgeons should use rectal abdominal surgery. Abdominal surgeries use large belly incision can cause long and painful recoveries. Transanal endoscopic microsurgery, a good option for people who are having multiple heart conditions and can't tolerate open surgery. You may use some microsurgery. So they are saying about a lot of other people who can use non-cancerous, infected, fissulas, rectal cancer, rectal prolapse, narrowing strictures, then thin, painless. Why? Because it is less bleeding, lower risk, quicker. Then that is all about text A. Now see, when you get the transition to text B, you should know, okay, text A is about this, text B is, they are likely to instruct who? Health providers. So they are going to give us certain rules and regulations. What are those? Avoid eating, limited diet, stop eating. You will receive general anesthesia, sleep like. In endoscopic microsurgery, your surgeon, they are going to do certain things. So all those instructions and what you are expected to do is all given in text B. Now let's go to text C. So TEM complications. So any complications go to C. Now text D, a lot of procedures are mentioned along with some study. Okay, now I know it's about study, complication, procedures and all those things. Now after this, you're going to go to the question. First, you're going to underline, skim the text, then you go to the question. Bensi Justin, good afternoon. So as I mentioned, leader Jacob, good afternoon. 20 questions. These 20 questions are divided into 3 types. So this is very important. Okay, so you should know what are the 3 types, what are the instructions. That should be by heart. You're not supposed to waste your valuable time. So as of now, 1 to 7, these questions are called match the following questions, where the instruction clearly says you may use any of these letters A, B, C, D, not only once, more than once, because 1 to 7. So that instruction, question numbers, what are the type, everything should be by heart. And after that, go and underline the keywords in the question, because part A is about keyword reference only, nothing else. I'll show you why. So why does the surgeon fill gas in the rectum while doing the procedure? So where are they talking about gas procedure? It should be there in where, isn't it? It should be there in fill your rectum with gas to get a clearer view. So the gas only one place. So Do you really need to worry about? No. B. Done. Understood by keywords? Now see, if you remember, adversity is observed following transanal endoscopic. Adversities should be, I love that word, okay? You've gone through a lot of complications. So where are they talking about complication? For me, C. Now let's see if it is there. Yes, adversities are there. What are those as mentioned in C? Understood? Now, covariables employed in the primary analysis to select candidates. So, select candidate means something to do with the study. Where are they talking about study? D. Now, let's see if it is covariable and all mentioned there. Covariables, primary, all those things are mentioned. So, no doubt. D. How should a patient adjust their diet? So, where are they diet? Diet, I know that it is there in B. So, transanal. Let's see if the D is saying anything about, B is saying anything about diet. See, avoid eating food, limit your diet, stop eating. So all those things are mentioned. So answer is B. Understood by keywords? Please always remember, keywords are very valuable. What benefit does the endoscopic microsurgery offer? So what are the benefits that you get? Definitely in A, isn't it? What are the benefits? You get a lot of benefits. Why? Because it is a good option for people who have multiple health problems and tolerate open surgery. So that is good for them. So the answer is A. Source of record utilized. So record, definitely study. B. What is the source? They're saying about Taiwan Cancer Registry 2007 to 2015. Done. Now, who are the optimal candidates? So who? That means definitely people, isn't it? They're talking about different people who can. Why? You may have transanal endoscopy to treat non-cancerous rectal tumors, infected passage, all those things are there. So that is why it is A. Clear? Now the next set of questions, these are called 8 to 14. Please note the number 8 to 14, and these questions are called short answer questions. Now, instructions by hearted. It can be a word, number or numbers, word and a number, short phrase. The short phrase can be anything between 2 to 3 words. Always remember this. Strategy doesn't change. Underlining keywords are the only way to find the answers. There are a lot of 7 out of 7 popping up. Revati, Sony, Anisha, Kalei, Betsy. Absolutely good enough. Keep it up, keep it up. Monica. Kavita. Good. Right, now let's go into question number 8 to 14 and 26. Good enough. Now, which method, Jenny 7, good enough, was employed historically for treatment rectal cancer? So, were they giving anywhere in A? I am sure it is there in A. Anita Simon, Akila 7, GB Wagi 7, good. Now, what is that? Historically, what are they saying? Before, what did they do? In the past, historically, surgeons did, what did they do? Open abdominal surgery. So the answer is a 3-word answer. OPENABDOMINALSURGERY. Anita, Akila, Jibbi, Susmita, all there. Good. So the answer is a 3-word answer. Then, next. How many individuals completing follow-up have received intensity modulated radiotherapy? Do you really need a second thought? How many and all those patients and all? It should be there somewhere in D. Now, next thing. What is the next thing? Intensity modulated radiotherapy. So where is this intensity modulated radiotherapy is the next question, isn't it? So intensity modulated radiotherapy is IMRT is what? According to the text. Now, how many patients is the question? Very good. It is 1118 for IMRT. You get that from text D. So 11118. Good enough. What is the subsequent, that means next, definitive procedure performed after 3D conformal radiotherapy? So again, it should be there somewhere in D. Now, what is that? First thing they're saying after. So 3D CRT is followed by protectomy. PROTECTOMY is the answer. Subsequent, next. Okay. So when we pump in the vocabulary, it's always for you to get exposed to that. Okay, as what 𝐻𝐿 was saying, we try to give you a lot of vocabulary, because when you study vocabulary, you really don't give that kind of an importance. So now you would know that a word difference or what you assess can be a significant factor between you and your answer. What are the infected passageways in the rectum treated with transanal endoscopic microscopic surgery called? So now where are they talking about? Infected passage in the rectum is called as fistulas. Fistulas. Straight answer. What is the first line instrument used by the surgeon through the anus into the rectum called? So first line, anus, where are they talking? So it should be there. So what is the first line? Where are they talking about? They will be talking all those things in B, isn't it? They are definitely talking in B. So what is the first line? Insert the rectoscope through. So the first line, first one they are going to do is rectoscope. 𝐅𝐸CTOSCOPE. Very good. Now, 13. What material aside the dissolvable stitches is employed for suturing the rectal lining? So there should be, instead, you are using dissolvable stitches, then what else? So this is also again in B, isn't it? What are they going to use? They're going to stitch your rectal liner with dissolvable stitches and metal clips. Two-word answer, METALCLIPS. Now, in anastomotic dehiscence, what is evident in the absence of visible leakage? So where are these keywords there? Where are these keywords there? Definitely in C, isn't it? Is it there? It is there. Anastomotic dehiscence. Without leak, there will be an extensive retroperitoneal air. RETROPERITONEALAIR. Now the final set of questions. These are called fill in the blanks question, where the instruction is as similar to short answer question, but redundancy. Do not write even an article. If you repeat, it will go wrong. Short answer, it's fine, but here it is. Be very cautious. A diet restriction to clear liquids is essential in the dash hours leading up to the surgery. So definitely up to the surgery hours and all what? 12 to 24. So the answer is 12 to 24. The balance are all given in the question. Now, microsurgical instrument in transanal endoscopy removes tumor, small amount of surrounding tissue. So where are they talking about? Definitely again something to do with B. So what are they removing? They are removing what? Remove tumors or polyps. POLYPS. Straight answer. Now, next one. TEM is advantageous for its reduced risk of both dash and bleeding. So somewhere they're talking about bleeding. So what are the other things that they're talking about? It should be there somewhere in A. See, they are talking about low risk of bleeding and infection. INFECTION is the answer. Good enough. Now, rectal tumors and other issues are addressed without dash through a procedure known as TEM. So they are talking about something. What is that? Without an incision. So any incision which comes from the very first sentence of the paragraph. INCISIONS. Now, a dash. So a means definitely the next word should be a consonant sounded word. Isn't it? It will never be vowel. Okay, this is how another keyword you have to refer. May be necessary in the presence of rectovaginal fistula following the transferred endoscopic microsurgery. So where? Definitely somewhere in C, isn't it? That is all complications. So rectovaginal fistula needs for colostomy. COLOSTONY. Very good. The ultimate question. The given record in the study group was taken from 2007 to 2015. So straight away go to D. So 2007, 2015, where Taiwan Cancer Registry or TCR, anything is a fine answer. So I have fired my 20 answers. It's high time that you start telling me what are your doubts if you have any. If not, what are your total scores? Few here and there glitches have been made because you didn't underline the keywords. Apart from that, most of you have told me all right answers. So tell me, what are your total scores? Or if you have any doubt, please be kind enough to let me know. Subiraj, 19, stunning. Soumya, 18. Good enough, good enough. Keep it up. Betsy, 20. Absolutely good enough. Very good. How about others? Sony Raju, 18. Good enough, good enough. Hey, 20. Absolutely, this is the power of I will. Is it? Good enough. Anita Simon, 18. Jibby, 18. Good enough, good enough. Keep it up. Atira Sally, 20 out of 20. Absolutely good enough. Excellent. Keep it up, keep it up. Dimple, 19. Very good. Keep it up. Akila Sham, 19. Excellent. Keep it up, keep it up. Monica, any incision? No. Incision. Yeah. Kalei, extensive? No. Extensive is not needed, isn't it? Why? Because the question is saying, what is the question saying? The question is saying, in anastomotic division, what is evident even in the absence? So what is evident? Peritoneal head. Kavita, 19. Monica, 20. Absolutely good enough. Anthony, 17. Monica Vegas, 19. Alfina, 19. First time Sheena, 20 out of 20. Keep it up, keep it up. Good, good, good. 17th answer is infection. Excellent. So as you have all said first answer and you're all happy with whatever that, you should be happy with whatever that you have got. Okay. So when you do make that yourself the standard, okay, tomorrow I'm going to go one step ahead. That's how you learn. Revati, 18, absolutely good enough. So I don't see anybody asking any doubt. So because, okay, some comment with extensive. No worries, no worries. So yes, because there is no doubts from your side. So I'll take a leave now. Until and unless I see you all tomorrow. Adios from me. God bless you all. Stay blessed. Take care. Bye.